My name is Barb Phillips, TapRooT instructor and subject matter expert on nonverbal communication. Today we're going to talk about investigative interviewing and how you can decode nonverbal cues. A lot of people want to look at a person's face when they're decoding nonverbal cues. That's really not a very good place to look because we can mask our facial expressions. So today we're going to take a look at some bigger movements of the body. Let's take a look at this example interview and identify some of these key movements. In this video, a nurse fell asleep while monitoring a patient's oxygen. During the interview, she tried to hide that fact. Let's see what body language behaviors may display when an interviewee is holding back information.
What time did you begin monitoring the patient's oxygen?
My shift began around 10 p.m., so I was monitoring the patient's oxygen every 2 hours.
Every 2 hours?
Yes, every 2 hours until 6 a.m.
Okay, so what time did you first check on the patient?
The first check was around midnight.
Did you make any adjustment to the patient's oxygen at this time?
No adjustments were necessary at that time.
Okay. What time did you make the second check?
The second check would have been around 2 a.m.
Notice what is going on here. The nurse is pressing her forearms together. Pressing the forearms together is a blocking behavior. She may be literally blocking herself from the interviewer to protect herself from a perceived threat. There is also a second body language displaying. The nurse is cupping her neck. This is a comforting behavior. Cupping the neck creates a calming sensation in the body, and we do it without realizing it when we feel stress. Let's continue the interview for more clues as the nurse continues to cover up missing the 2 a.m. check.
So you checked on the patient at 2 a.m. Did you adjust the levels at this time?
I checked and the patient was doing fine.
Here the nurse is maintaining constant eye contact. Sometimes that can be an indication of lying. A person may maintain eye contact with you to see if you are buying their story. The second notable movement is how the nurse shifted her body toward the door, feet pointed toward the exit. When interviewing, note it when someone shifts any part of their body toward the exit. People do this subconsciously if they feel they want to escape in an uncomfortable situation. Finally, note when the nurse said the patient was doing fine, she was shaking her head side to side, which indicates a no answer. The nodding of the head affirmatively or the shaking of the head side to side negatively should match a person's affirmative or negative words. Keep in mind that body language alone cannot determine whether or not a person is lying. However, noticing when the person is self-comforting, blocking, shifting toward an exit, keeping constant eye contact, or nodding affirmatively with negative words or shaking head side to side negatively with positive words, there may be something he or she is hiding that you may want to investigate further. Thank you for joining us on the TapRooT Learning Channel. Comment below with any questions.